so basically, my first startup was in '95, and so it was associated with a electronic noses analytical system. Caltech Vision is another company, which I'll talk more about, which is intraocular lens, which is something that goes in your eye when you get old and have cataracts. A company called Materia, which I misspelled. Should be an I there. And it's really the thing that really started a lot of the stuff. And this is truly, starting out doing fundamental chemistry, trying to understand chemistry, and then getting to something where suddenly people were interested, and so then what do you do? And so that company was started in '98. Value company we just started, and so that one turned out to be VC funded. It lasted 5 years before it got sold. Caltech Vision actually just phase 3 trials and doing really, really well. Materia is doing okay. Contour Energy Systems with a battery company. It was started in 2011, folded in 2014, and then we started another company recently, which I'll talk about at the end, which is think for treating urinary stones, and it's angel financing. So there's one message that you should get from this. Okay? Which companies have survived? Okay? Angel funding, angel funding, angel funding. Okay? Which ones have not survived? Venture capital funding. And one of the problems is venture capitalists just don't have the patience to deal with the developments. And so you see, these were started a long time ago. And so it takes 15, 20 years for technology to get developed that's really different than you. And so they're accustomed to doing, Facebook, all kinds of things where you just do computers, you got to write a program, sell it. This stuff you got to do real science, and it's really hard. So finding people who have patience is really sort of one of the lessons. Then the other thing is, which is my lesson, is do it for fun. Don't do it for money, because you're going to be disappointed almost all the time, because most companies fail. And even if they do succeed, by the time they succeed, you've raised so much money that you've lost all your ownership in the company, so you don't own anything. So do it for fun. Okay? I still haven't made a cent out of any companies. I do it for fun. Okay? Hopefully someday I will, at least my grandkids will maybe make someone out of some of these. Okay? So the first thing I'm going to talk about is this one, which is Materia. Okay, misspelled. And it's based on chemistry that we've done our whole career. So this is a reaction which I learned about when I was a postdoctoral fellow in 1968, which is before most of you were born. And it was an amazing reaction. I was just moving into the field. And it was a reaction where you took propylene, so 3 carbons, you passed it over a catalyst. And the catalyst was a mixture of a lot of stuff and nobody quite knew what it was. And what you got out of the other end very rapidly and very cleanly was ethylene and butene. So what you'd done is you had shuffled the carbons, and pretty early on it was demonstrated that it was the carbon-carbon double bond that was broken and things were shuffled. Okay? So that's the metathesis reaction. Actually, when it was originally started, it was sometimes called olefin disproportionation, and sometimes olefin metathesis. So I started my career at Michigan State University, and the chairman was named Mike Karabatsas. Guess where Mike was from? So Mike came by one day and he said, disproportionation is Latin, metathesis is Greek. It's always been metathesis ever since. And the other thing is the early catalysts didn't tolerate anything. I mean, they basically just did hydrocarbons, because they were very Lewis acidic systems, and if you put in any functional group, it killed the catalyst. So this didn't seem like it was very promising for doing organic chemistry, but it was an interesting mechanistic question. So we spent a lot of time worrying about mechanisms, how it all happened. Spent 10 years working on mechanisms, and that's probably what got me from Michigan State to Caltech, and getting it all sorted out. And then we spent a long time and long history, and then in '92, we developed our catalyst based on routine. In this catalyst, instead of being one that was killed by functional groups, actually like functional groups. Sort of like water, which nothing had done before. So this started opening up metathesis for lots and lots of applications. So it was a very simple complex. The key is this metal carbon double bond. which is the key for the overall mechanism. Okay? And so with the catalyst in hand, we started publishing papers. You know, that's what it was all about. And in fact, I started doing the catalysis because I was an assistant professor, and I just wanted to get tenure. It was a reaction. Everybody else was working. I was going to do it. I'm not going to have much competition. I didn't really think of ever leaving it. So I was really surprised when we finally got a catalyst that actually worked. We published it. People started getting interested. People would call me up and say, "Can I get some catalyst?" And I'd go down and beg my graduate student. Some of them went. He was an amazing graduate student who made our first catalyst. And can you give me 10 milligrams? And this is really a bad thing to do because not only did you have to work really hard to make it, you were also going to give it to somebody who was going to compete with it. So it was, anyway, so so a lot of sort of companies started asking about it. Some small companies started making catalysts. And people would call me up and say, "Your catalyst doesn't work." And I'd say, "Send me some." He'd send me some that really wasn't catalyst. It was mad at me. And so there was a lot of things. And then the other thing is, which is really important, just about this time, just before, were two things which really made doing academic, industrial, commercial stuff really easier. And one was this act, by Dole Act, which hopefully will stay, it'll survive the present climate. And basically, it gave the university rights to stuff that was discovered. So if you did things with NSF, NIH, any sort of federal funding, is that the university got the rights to it. And so that really sort of changed things in the late 80s, early 90s for lots of stuff starting to happen in U.S. universities. Then the other thing was provisional patents. And they came in again at about the same time. And before this, you had to write a patent, submit it, and get it covered and all kinds of stuff before you could really publish. And that makes it really hard for academics. So there was a thing called provisional patents, which get replaced. And so you basically write things up. And half the time, I'll send in a group of slides. Getting ready to give a talk or a paper, pre-drafted paper. You send it in, it gets filed as a provisional patent. And you've got 1 year to collect all the data and make stuff happen. So it means you can now start to publish really fast. So that made life really easy for both sorts of things. I'm not sure about this in Australia, how that works. And so then big companies started coming along. They started coming along and, wanting to interact. Okay? So there's a bunch of companies, I didn't put any names here, to protect the guilty. So the first one came along and, we've just filed a bunch of patents, you got to work with us, we're going to bury you. Okay? That's the way to start a collaboration. Company A we started collaborating with, and we didn't hear from them, and they said, might as well, quit working this year because we're going to kill you. Company B turned out to be really good collaborators, but then the champion got promoted because he was really good, and so technology died for a while. The company B started manufacturing and selling catalysts, really sort of with some rights, and Company C, after they were buried, left the field. They actually donated the patents to Caltech. And Company B turned out to really be a good collaborator, and so we've got a lot of stuff going with them. Company B sued us, and we sued them, and it finally got settled. And then the last one is Company E, and they're the evil ones. So they're really patent trolls. They got control of a patent that was related to our stuff. They spent an amazing amount of money on lawyers, and if you spend enough money on lawyers, they get a lot of stuff done. We just finished a trial; it's still going on. Horrible thing is that the judge was an English major, and the jury were people off the street, and they're expected to make decisions about your life's work. So it's really a brutal thing, and sometimes I wish I hadn't been patenting any of these things, but we'll get there, and soon that'll be over with. Unfortunately, soon the patents are over with anyway. So it's still going on. So anyway, so then we said, okay, working with big companies is really, really tough. And the other problem is again, what's happened in the US is when I was a student and was getting out, you had a choice of going to DuPont Central Research, Dow Central Research, Union Carbide, on and on and on. Okay? And there were people in those places with Rager papers and jacks. They then did the translational work to get it ready to go to commercial product. So things happened. They're all gone. Okay? So there's no one there to do it. So now you almost have to do everything through small companies and through startups so you can transition the work in, and then you can start to interact with the big companies. Okay, so Caltech had a fund called it Grubbs state. I don't know whether you're familiar with that term or not, because it's a term that whenever a miner, wanted to go out and look for gold, they would get what was called a grub, food stake. So it was there, so that was it. I call it Grubbs state. It's good fun. I've got a lot of good stuff. So it's a fun subject, Caltech, to help do translation stuff. Okay? And a postdoc really did it, and he was the founding CEO of the company. So then we started a company called Materia. Caltech licensed everything to them, so I don't have to worry about it. So especially past and future, which is pretty unusual. And then the other thing is too, which is a thing for thinking about institutions doing this, is that Caltech has a really good policy. I think we probably have the best tech transfer office I know of. And essentially, Caltech's thing is that they want a company to succeed. And if you take large upfront fees, the company's not going to succeed. And if you have large licensing fees, it's not going to succeed. And so basically, if I have a discovery, I can go to our tech transfer office and say, I want to start a company, I want exclusive rights. They'll give me exclusive rights for a year. I can go out and raise funds, put it together, and then they can negotiate the license fee and stuff, which makes things a lot better. Everybody I work with wants to work with Caltech. So anyway, and then the other thing is they say, look, we'll make money two ways. We'll take equity in the company, not a lot, but some. But if we make professors happy, and we make them successful, and they make money, they'll give us money. So they think that's the way that they actually end up making the most of this. Okay. So there's another sort of thing that you've got to think about if you're going to develop technology. There's a kind of technology called platform technology, and this is something that goes on a lot in academics, because you want things to be platform. You want it to have applications in many cases. So here's the basic reaction again. Here's one of the catalysts, and it's now being used to make pharmaceuticals. So the bond right here is made by this chemistry. That turned out to be 1/2 of the first drug that was used to cure hepatitis C. We'll talk more about that in a minute. There's a company called Aileron, which is making peptides for treating non-druggable diseases. And so this is sort of the drug business. You can make really big polymer parts, John Deere combines and wind blades. I'll talk about some of these, using the same catalyst. It's being used in a company in Indonesia for making products out of seed oils. It's being used to make small molecules for controlling insects, being used in oil and gas. I'll talk about that. And it's being used to make specialty polymers. So it's got a lot of applications, and that seems good, but it also is one of the hardest things to do. Because when you're starting a company, the worst thing to do is not to focus. Second worst thing to do is focus on the wrong thing. So you've got, so there should be a whole business school around, at least courses in doing platform technology, because it's really, really hard to manage and do. And so, for example, everything is different. So pharmaceuticals, they take a long time. So here's chemistry that was done by Helen Blackwell and Scott Miller. They're both professors now. And it was done in '96, so 20 years ago. They did this thing where they make peptides, and they start out with 2 double bonds, and you put in our catalyst, and you flip those together, you lose ethylene, and you make a bond. So that now stabilizes these structures. And here's the drug that's in the Janssen J&J thing. You see it's a peptide. that bond is put together in the same sort of fashion. So that was put together with the ruthenium catalyst called the litio. Took almost 20 years from the time we sort of started this, and I talked to people who did the earlier versions of this, and yes, we read your paper and we started working on this, and so it's taken a long time. And the deal is, you know, again, in developing things, this was a huge success for about 2 years. And then it got taken over by something else. And so, you know, it's stuff. So here it is. Put it over here. You know, you can get the stuff. There was an earlier version which was Berlin time, where they made it here. This is now. If you look at those two, unless you're an organic chemist, you know, they look really close. And they are, but they're separate patents and separate everything. So this one went, and this one didn't. This one had some toxicity problems. It was phenomenal drug with toxicity problems. This one apparently is phenomenal drug without most of the toxicity problems. So that's going strong. And now there's another one that just came out. I found out last week. So July 17th, it was just approved. And again, it's a structure. It doesn't have a double bond in it, but there used to be one there, so they can hydrogenate it, and it makes a better system. So this now is going to be part of Gilead's hepatitis C treatment for all the really tough cases. So it's going to be a 3-drug cocktail. So that's sort of one thing. So there's you know, and then there's this stuff which is stable peptides, which I talked about, which is this company, Aileron. It's going forward again, so it's another 20 years. They're just in humans, but they haven't really gone very far yet. I mean, you can use it to make bonds and all kinds of other things in pharmaceuticals. And this is a tough business. Every one of these areas is different. For example, pharmaceutical companies are accustomed to getting everything free. Okay? So the policy in the past has been NIH funds academic researchers. They develop new reactions. They don't patent them. Pharmaceutical companies take them and use them. And if you do patent one, they'll work their way around it. They put it in this one, and so it's been a real headache and a hassle and a big trouble. But they're changing. They're catching on. The other thing is you have absolutely no control over your business. You're totally dependent on the pharmaceutical company, whether they use your catalyst or whether they go forward with it or whether it gets out of phase 2 or 3. And people are really slow to do things. I've shown you this 20 years. Okay? They have an interesting licensing strategy. For example, they don't license things. They buy catalyst and everything has to be in the catalyst price. Okay, so all you can do in this case is sell catalyst, and so you sit there twiddling your thumbs until they call you up and say, I want to buy 100 kilos. Okay, so that's one sort of business and sort of one direction that you're going. The other one is just another way of doing it. So Cargill, which is a large ag company, approached Materia and said, we have a lot of seed oils, and seed oils are long, fatty esters, and they have double bonds in them. So they have double bonds, you can do chemistry, by metathesis. And so you can make polyesters, you can make hydrocarbons, you can cleave them and make all kinds of stuff. And so this looked like a really cheap source of carbon. And so started a collaboration that looked pretty good. So they spun off the company. So now you create your own customer. So now they are going to do this. They're going to use the catalyst to make compounds. The other thing is, if you're going to do catalyst research and you want it to do anything outside of pharmaceuticals, it has to be really, really robust. Because it turns out that, you know, this first plant, 400 million pound a year plant, it's in Indonesia. It's basically part of a seed oil operation where they make cooking oils and other things. Essentially, here's the scheme of what we call a biorefinery. So you start with seed oil, you do a little purification, you crack it, you distill it, you take the parts and you sell it. That's exactly like a refinery where you start with a barrel of oil. You can't do much here because these things are too expensive. This has to be really clean, so it turns out through the cleaning system. You put in other reactants, you break it, clean it down, so there you go. At the time when they started, they thought this would be viable at $50 a barrel of oil. At the time, it was 120. No one ever thought it would get below 50 again. It's below 50 again right now, probably. Not really soon. But it still turns out you make different products. And so again, it's timing. It took a long time to get there. So all the catalyst is manufactured in Nigeria. Here's the plant in Indonesia. Okay. And what's the problem here? People advertise this as green, and green is good, but no one spends extra money on green. Okay? If it's the same as everything else, it's okay. But it's got to be there. The other problem is you're making new products. If you're making new products, they have to qualify. People have to find uses for them. So it turns out that although this looked phenomenal, it's green, et cetera, it's taking a long time because you've got to find homes for all these parts and pieces. So you can't sell them as fuel. Fuel just doesn't make it anymore. So you've got to find bits and pieces for all these sort of things to sell. Okay? And so it got cranked up in 2013. It's been running off and on since then. They've made lots and lots of stuff. They've burned up a lot of catalyst, which is good. So it's rolling along. But so biorenewables are good. You know, you got to have a good, robust system. Because in this case, you're basically taking things in Indonesia where the humidity is 95% and taking it right out of a tree and crushing it and doing stuff. So you got to have a really robust catalyst. As petroleum prices get to be more expensive or other things, and people are worrying more and more about CO2 stuff, and so this is so the cost is not quite as big a deal. It's got to be cost effective. Just because it's green doesn't sell anything. It's got to be cost effective. And so the other thing is too is I'm pointing out to people, if you're a catalyst chemist, we need catalysts because in the past most of the catalysts have been involved in starting with petroleum, so carbon and hydrogen based things, and putting in functional groups, oxygen, nitrogen, and other things. Most of the time when you start with a natural thing, they're too highly oxidized, so you have to take out functionality, and so it's a whole different sort of way of doing things. And the other part of it too, which is really important for students to think about, is we're starting with a seed oil. So CO2 is taken up by the palm tree, gets turned into palm oil. So this is, CO2 based. But so that sounds really, really green. But the problem is that where do palm plantations come from? Palm plantations come from burning down forests. And a lot of forests are getting destroyed. And so the question is, and then you're taking food and turning into chemicals and fuels. So there's all kinds of interesting questions. And so as a student, people usually make decisions in this area. You either know the science, you know the sociology, you know the economics. Not many people know all of them together. And it's going to take people like that to be able to make decisions about what's really important in this whole business. And what's really sustainable and what's not. So we'll see where this all goes. It's looking pretty reasonable now. A little bad for a while, and it's starting to move along, so we'll see. Okay. So another related sort of topic, and this one qualifies as sustainable and green. Okay. And this is pheromones. And I left out my good slides, which is basically how pheromones work. And so it turns out pheromones are chemicals that insects use to communicate. And what's the most important thing insects do is agree. And what do you want to do to control them is you want to prevent them from breeding and making more insects. So it turns out that during the mating season, female insects become really good synthetic organic chemists. They make specifically one compound. And they release it out in the breeze, and the males become really good analytical chemists. In fact, they can detect this molecule almost at single molecule level. And so then what happens is the female set up in the tree, protected from the birds and other things, and the males are flying around, and they get a whiff of the pheromone, and they start flying up the concentration gradient. So not only can they detect it, they can detect the concentration. So as they fly on the concentration, they fly back in, and so it takes somebody from the female, they mate, she lays eggs and causes colds. So what can the farmer do? The farmer can find out what this chemical is and spread it around the field. Before males fly around, it's everywhere. There's no concentration gradient. They don't mate. You got the problem solved. Okay? So this actually turned out to be something that's being used more and more and more in the U.S. In certain areas now, you can't use certain pesticides, and so this is the only way to control the insect. And you see they're pretty simple. And they look like molecules we've seen before. These look like fatty acids. They probably are derived from. Okay? But they have this special bond in most of them, which is called a cis-cell bond. So the things come out the same side. If they go out the other side, it's a different molecule. And so it turned out these are hard to make. And so we ended up making a new way of putting them together by catalysis. You see, this is pretty complicated looking catalyst, but that's what we love to do, is play games and make them work. And so these we now got to the point where we can now make pheromones in good yield in 1 or 2 steps rather than 8 or 10 steps and other kinds of things. And so this now is getting licensed by a company that makes pheromones and being transferred for home. So hopefully, pretty soon, catalysis will be frustrating bugs. And I put these pictures up because, I talk to people and they think we're killing butterflies and beautiful insects. These are really so they're okay to control. And we're not killing them, we're just frustrating. Okay? So pheromones, it takes a long time, lots of stuff. It's a lot like pharma, other things. Cost of goods is not really good, really a problem. So in this case, when you use your license, you sell catalyst. This is another area. So this is a very different area, but it's still the same catalyst. Same catalyst we use, different flavor. So you start with cyclic olefins. So when you start with a cyclic olefin, and if you break this bond, you put the pieces together, you hook a bunch of them together. So this is called a monomer, and that's called a polymer. Polymers are plastics. This turns out to look like a pretty complicated monomer, but it's cheap. It turns out to be a byproduct of petroleum refining. It's a big part of the C5 stream. So when you put a barrel of oil in and you crack it, you get C2, C3, C4. Those are good for chemicals. C5 is not good for a lot of things. And then C6 and higher is gasoline. So this is sometimes burned. And so you make C5, it's like a dimerizes by Diels-Alder reaction for people who have chemistry. Okay? And then you crack it and make that. And you can make lots of derivatives for this. And it's really tough. You can, here's a piece of plastic, which these are 2 9mm bullets. Been shot into it. You see it's not very thick. Certainly wasn't holding it when we shot it. And the other question people ask is, if those are 9mm bullets, what's the difference? Turns out that's a US 9mm and that's an Israeli 9mm. It turns out they have really interesting properties, which can do a lot of things. They're now commercially being used to make cell covers. So this is for putting over electrolysis cells where chlorine and caustic is made, so it's really there. This is an area that's been going on for a while, oil and gas. These things are called centralizers. It's a pretty big deal, but this is really exciting. So this is really the first sort of monster application of this technology, which was just announced last year. And essentially, what this is doing is Shell has a whole new oil field in the Gulf of Mexico. And these oil fields, they start drilling at 7,000 feet. And that sounded, I have no clue how to do that. But anyway, so they start drilling at 7,000 feet. And then when the oil comes out, it turns out that it comes out at very high temperatures, about 200 degrees C. And then as soon as it comes out, it hits 1 degree water. And so you've got to keep it from cooling too fast, so you can't pump it and stuff. And so there's got to be a layer of insulation. So you've got these pipes that are, this big around, and you got to have about that much insulation on them to keep them from doing it. And it turns out people have been doing that for a while, but all of the materials they had made before decomposed above 150 degrees. So there was no way for them to recover this oil based on any of the technology they had. So the guys at Bacteria, since we make a polymer that's all hydrocarbon, which means water can't get in, and it's really stable, it doesn't hydrolyze at 200 degrees with water around. So they made a material which is stable at 20 degrees C and has all the mechanical strength and everything that's needed. So now there's 40 miles of pipe sitting in Louisiana, pipe this big around, that's coated with about that much material made using ruthenium metathesis. It's 40 miles of it. It'll soon be put in the bottom of the Gulf to pump oil out of the bottom. So it turned out to be the only solution. And that's sort of what you need when you're introducing new products. Is that it's really, really hard to introduce a new product because people got to test and all kinds of stuff. If you're trying to replace an old product, they're used to the old product, and you've got to be so much better than the new one. So if you can find a place where it's the only thing that works, you've got to go. So this is the first time that's going to happen. So pretty soon, these pipes are going to get lowered down, they get welded, and anyway, it's a pretty amazing operation what these folks do. So that was good, so that sort of saved the company and made everything work, and things are going pretty well now. Okay? And then, another thing is now we can do functional groups, so we're starting to work on making windmill blades. I think the wind is sort of big in Australia, so lots of folks down here. So it's based on the chemistry that's around. It's really tough stuff. Competitive pricing, etc. But why isn't it being used? One is timing. We were late. Sort of the big wave of wind turbines sort of passed. The other thing is that you have to change processing slightly. And people don't like to change processing because it means they have to invest in new tools. And so we're now trying to get in early enough into processes so we can take advantage of the really good features of this and get it used. Okay? So new materials. Really long qualifying time, requires major testing. Old materials is hard, place the process may be easier. And so the first really big application is in oil and gas. So this is pretty amusing because when the Nobel Committee made the announcement, they made a big deal about this being green. Okay? So what's the first big application? It opens up a new oil field. You never know where your technology is going to go. You do it, and it happens. Okay, so that's sort of, the basic research. So this is research where we started, here's a reaction, how does it work? Once we learned how it worked, then we made a better catalyst. Once we made a better catalyst, then we started finding new applications, other people started finding new applications, and we were sort of forced into developing a way to commercialize. So that's one thing. The other part of it is, as I pointed out, it's a platform technology, which makes it really hard to manage and really hard to do. And so people need to have professional skills and tools for that. What I'm going to talk about next are some of the other areas we're working in. This is sort of my hobby in my old age, which I'm having real fun with. And this started in a very different kind of way. So it started in the mid-'80s. So Arnold Beckman, how many people know the name Beckman? Beckman Instruments, Beckman. Half of Caltech's named after Arnold Beckman. He was actually a professor at Caltech, got his PhD at Caltech, stayed on to be a professor. And at the time, Caltech was in the middle of a bunch of orange groves. And so his neighbors said, we're tired of doing titrations. We want some fast way of measuring the pH of our orange juice. So he built a pH meter, the first one. And it was successful. So his other neighbors wanted one, so he started making other pH meters. And he made a decision which really changed a lot of things in Caltech. Is that he basically said, I can't be a professor and a businessman at the same time. So he resigned his professorship and basically started Beckman Instruments and made an incredible amount of money and gave a whole lot of money to Caltech. It worked out well. So Beckman was a really creative guy, and so in the 80s, he had a lot of eye problems. He lived to 102 or 3. I was at his 100th birthday party, sitting near the cake, and he pushed it over and said, I don't have to blow them all out, do I? But he was really interested in eye stuff, and so he was funding stuff at USC, and he wanted somebody from Caltech who knew something about polymers. And at the time, no one in academics really, in chemistry departments, did polymer chemistry. It was in special sort of departments and stuff. I was just starting to do a little bit. So I got drafted to help Arnold with his polymer project. And I was the only one who could say polymer twice. And so we worked on that. We actually ended up with a patent. And so I got really involved in a lot of things. And then a real breakthrough came in the mid-90s. A character named Dan Swartz, who I still work with, showed up. He's a young guy. We joked we both had hair then. He's basically a really creative man and identifies lots of problems. And he identified a problem in the interlocular lenses area that we came up with a solution for, and it's sort of started us on a program where now we probably have 10 or 15 projects going, which are related to the eye and other medical things. And I'll give you a couple of case studies of how this happened. And the first key thing is I've got to find a Dan Swartz. A lot of people tell me that they're going to solve medical problems. And I ask them who you're working with, and if they don't have a really good clinician they're working with, they're not going to solve the right problem. So you got to get people really involved really, really early on. Because they've got their own game, you've got your own game, and you've got to be able to make it so that works for everyone. So here's a cataract. So for young people, you've got a lens. Here's a lens. Okay. So a lens in the eye when you're young, nice and flexible. There's muscles here that pull on it. So they pull and they stretch it and change the shape of the lens and focus it. When you get to be in sort of early 40s, this gets to be not as flexible. And then you wear 5-foot with reading glasses, so you can't focus as well. Then you get to the 60s, 70s, 80s, and it turns into a cataract and starts to go away. Okay? And so now what they do is they basically go in with a sonicator and take out the lens and then put in a little piece of plastic, which is shaped like a lens, and it's the most successful surgery around. You see it's held in place. These are pieces of plastic. The original ones were just plastic fishing line, old haptics. And it's sort of a floppy system, so you can see the problem with that. So there's about 3 billion done in the U.S. About 3 million done in the U.S. And so there's a lot of these. It's usually really successful. And people have been happy with this for a very long time. And you get a pretty good vision afterwards, but it turns out about half the people have to wear glasses afterwards. And in the day of LASIK and everything else, a lot of people don't like to wear glasses. Well, I've worn them my whole life, so I don't know. Yeah. So this turned out to be a good science problem. Maybe someday I'll have to wear glasses because we'll get this approved. And I'm hoping I can get these approved in time so I can actually have my own lens. Anyway, so the problem was identified by Dan. So basically the idea was, can we make a lens that looks exactly like the lens now, put it in exactly the same way, and after 2 weeks, after everything is healed, and you can't make good measurements ahead of time, and you can't really predict how it's going to heal, and so that's the reason we have this problem. And then after it's all healed and everything in place, you do an eye exam exactly the way you do now. But instead of sending them to get glasses, you do something to change the refractive power. Okay? So that was the problem we identified at 96, 97. And so Julie Parker was another faculty member. Here's Dan, and where he likes to be in the party. And then the other thing is too, which is really critical, is that Dan came and he had a problem. We came up with a solution, and that happens a lot. But the thing about Dan was, I came up with a solution, and he came up with cash so he could go hire a postdoc to see if it would work. And that's usually where many, many things die, is in this transition and doing the proof of concept. So we hired Dan Gish, and he did the polymer stuff and got the lens made, and then we hired Chris, who's polymer physics, and so he developed all the polymer physics side. He still works at the company, and Dan and I are still associated. Julie is not. So that was the original game. And the idea was a pretty simple one. And again, one of my rules in this thing is, if you start out simple, you might make it. If you start out and it's complicated, you're never going to make it, because it's just going to get harder. So here's a simple idea that's taken 20 years to get to approval. So essentially what you do is you make a lens out of a cross-linked matrix of silicons, like they do now. The little red things are what we call macromers. So they're polymers about 1,000 molecular weight. They have photoactive end groups. And then you put in photoinitiators and all kinds of stuff. And so then the basic physics of it is that if you irradiate the middle, you cross-link the macromers. So they become bigger polymers. And then over the next period of time, what happens is that you've got to go back to equilibrium. So the small ones migrate from here to here. So that shrinks this area and expands that area. So you change the shape. So if you do that properly, you can change the shape, and we're now doing it all over the place. And then once you get it in the right position, you can just radiate the whole thing, and it's locked in this area. So there's now about 5,000 or 6,000 people running around the world that have these lenses in their eye. Works pretty well. Here's some really early trials. I can't show you the newest stuff, but here was a commercial thing in Germany. Here's what people saw before, and afterwards, 25% saw 20/16 or better. So 20/20 is considered sort of good normal vision. It's hard to tell the difference between 20/20 and 20/25, especially if you haven't seen very well for a long time. So everybody's pretty happy. So essentially, we're there. The trials are sort of showing related kinds of things. And we can correct astigmatism, so you can put different patterns of light on. Okay? And so how do you dial in a real shape of the pattern of light? You steal a chip out of a projector, and then you can use that chip to generate the pattern of light you need for all different things. So we can now really precisely tune the shape of the light, and as I showed you, it works really, really well. Okay. We showed this worked in rabbits about 15 years ago. Rabbits don't complain, find problems. It's taken about 10 to 12 years to get through all the trials. So we're about really on the edge of getting phase 3 approval for this. So now all these things can really start to be sold in the US and things can happen. So it's taken, 20 years. A few projects, they say, we can't do difficult FDA things. Not going to last that long. Anyway, so the system now is, we had to develop a lot of new science and learn how to remotely control things, and so that's an interesting thing, new way to control. Chemistry is not commercial. You're in here, phase 3 trials are there, and something that tells you that things are about to happen is that the name's got changed to Calhoun Vision, which no one ever liked, and it basically turned out to be the street that Dan Schwartz lives on in San Francisco. So now it's become RX site, so prescription site, so we can prescribe precisely what the site's going to do at the end. And anyway, so it required a lot of work between clinical scientists, physics, chemistry, and the whole thing to get this done. And it's been, it's taken a while, and the reason is it's really hard technology. But we think it's really going to really go somewhere when they go. So that got us started thinking, so this is something that I'm working on a lot. This is sort of gets to be sort of where the hobby comes in, is that Dan and I about 4 or 5 years ago said, we're having way too much fun. Because while we were doing this, we were doing lots of other things. We probably have 10 projects going, different sort of things in the eye. So we said, look, it's time to get other people involved. So he basically recruited 10 or 12 people from top-level clinicians from UCSF, and I recruited 10 or 12 engineers, chemists. We don't let too many biologists in. We flew up on a Saturday morning, and they spent the whole day talking to us about their problems, and out of that came 4 or 5 different projects. We just had our 8th meeting at Caltech last week. Another whole bunch of projects came out of it. So it turns out that, what we're trying to do now is to get clinicians and scientists and engineers together under conditions so that they can define projects which can be solved by real engineering concepts. These are not solving drugs, these are not cells or anything. These are mostly like plumbing problems, where it's materials getting things into the right position. and getting the right young scientists connected to the right clinician in the right place. So we're moving forward, we're starting at USC. I've learned a lesson in how to do this. And so UCLA, USC and UCSF. Dan and I said we're going to do this. I recruited people, he recruited people, we got together and did it. And the tech transfer office did a non-disclosure agreement so we could talk about stuff, and that was it. USC wants to do it. So we go to USC, we meet the dean of medicine talks to the president of Caltech. I'm not sure we're ever going to have a meeting. So you gotta do it in sort of the right sort of level. So here's another interesting project that we're making progress on. This is called a chemofilter. Okay? This is something I never even thought about operating on. So this is the liver cancer. So liver cancer is one of the really toughest sort of ones around and really a big problem. And so now, you give chemotherapy, it goes everywhere. And so now we're starting something where you put a catheter in, you can put it right into the tumor and release a lot of chemotherapeutic agent. Unfortunately, some of it leaks out. And so when you do it this way, you get it more localized. So the basic question is, could we make something where we have a filter? So you put a filter in the other end, which will absorb the agent that leaks through. And some of these agents are incredibly toxic, and especially cardiotoxic, and that goes to the heart. So it's right there. Okay? And one they like best of all is doxorubicin, called Red Death, really bad. Okay? And so the question is, can we do it? The basic idea was, what does it bind to in the body? It binds to DNA. So what if we made something where we put a lot of DNA on it, which we put right there, so it came through and it would jump on the DNA. So we made our nanoparticles, coated them with DNA, and here's the chemistry of it. Our nanoparticles, blah, blah, blah. You can stick on the DNA. This is mustard. This is what's used for treating cancer sometimes, these mustard gases, nerve gases. So it binds them really tightly. And you can show that you've got all the goodies on it. And then you can put them in serum, put in doxorubicin, which is red. Then you put in your nanoparticles and pull them down, and it turns out the red disappears. And here's how it works in blood. It works great in water. A lot of things work great in water, but blood is really, really tough environment. So here's the control. So there's stuff there that takes it up. With the particles, we can now take it down to nothing. And I took out the gory picture. There's a pig up there, which has one of these devices in it. And it turns out that, here's the control in the pig. Here's before, after. Here's before and after. So, like none of all these things work. And so this is proof of concept. So now we're trying to figure out how to move it to the next level, because our nanoparticles are certainly not going to be things we can put in the body, but lots of other things we can. So this is again proof of concept. Maybe we start curing cancer. Another one, interesting, urinary stones. I never thought I'd be working on urinary stones. I didn't know they were important. Turns out that if you have them, it's really important. Probably the most painful thing around. And it turns out that it's the third leading cause of people coming back from Iraq and Afghanistan. Young males, dehydration, high protein. And it turns out there's been 8 space missions that have been shut down because of urinary stones. Same reason. They've always been announced that they completed their experiments early, but it turns out. And if man's ever going to go to Mars or any place, you're going to have a way to treat this outside of an operating room. So you can't have people sort of laying on the bottom screaming for 2 years. Anyway, so the basic idea is to develop a way of treating urinary stones outside of an operating room. We worked with Marshall Stoller, who's developed most of the ways they're used now. And so we ended up starting a company. And the basic idea is to use nanoparticles, microbubbles. Microbubbles, when you expose them to ultrasound, expand and then collapse and form a shock wave. And so they cavitate and they break things. And so the basic idea is to make these bubbles, inject them into the kidneys and the urethra, put on the side of this, that's our part, chemicals, which attached directly to the urinary stone. So you squirt them in, let them slosh around a little bit, and then you sort of give a general radiation of ultrasound and break them up, and away you go. So it works. There's a big thing that was really. So this is now actually, human trials are going on in India right now using this technique. There's a area in India that has more urinary stones than any place in the world. So we hope this will work, because we can take the treatment from a treatment that takes place in an operating room, it takes place in the doctor's office, or it takes place in a home video someplace. So it's something we hope will break the cause on this. And also, when people go in, instead of being told by the doctor, come back on Wednesday, I've got time in the operating room, and you go on the screen for 2 days, you can go get it treated right on the spot. So hopefully that'll work. Anyway, so common features of all these. Can't emphasize how much it's important to get a clinician to identify the real problems, rather than problems that you think are real. And also they help you define the requirements. It may be, troublesome, but one of the first things you got to learn is that if you're going to develop a thing that doctors are going to use, part of it's got to be how they're going to make money out of it. It's sort of surprising, but anyway, and so you got to come up with a basic thing. You get postdocs to help do it, and then you got to figure out what you're going to do with it. Whether you're going to license it, whether you're going to do all kind of things. And so we're sort of working through a lot of these things right now. Okay? So basic science and engineers can make contributions if you identify them properly. And that's really the key, is getting someone to do that. And many clinicians can't do that, but so you got to find the right ones, and that's really been fun. Okay? So anyway, once you do it, a lot of things. Oh yeah, there's a couple of things here that I should probably mention is that if you do this, you got to have time commitment. Some people I've known have started companies, and they try to run them, and that's two problems. One is you're an academic, and you got academic things to do. Number two, you're usually going to be a crappy CEO, and if the company survives, you get fired pretty soon by the people who put the money in. So stay out of it, find a good CEO, and let them run with it. And then you've got to worry about your time commitment. And then payoff, as I pointed out, if you do it for the money, you're probably going to be disappointed. So you do it for the fun, the excitement, being able to sort of bring technology forward that people might be useful for people. And if it sort of works, maybe your grandkids will make a little cash. Okay, so thanks.